What they don't tell you when preparing to travel over to the UK to work in the UK health sector as a nurse, a midwife, or any health professionals. Yes, you see those of us working in the health sector smiling, telling you how much we receive at the end of the month. We tell you how good life in the UK is, but there is the other side of UK nursing. There is the other side of working in the UK health sector. These things they don't tell you when preparing to travel over to the UK. This video is very good for all overseas healthcare professionals who are preparing to travel over to the UK to work in the UK health sector. And if you have just arrived in the UK to continue your journey as a nurse, as a midwife, or as any health professional in the UK, this video is very good for you. My name is Mordecai. This is the Nature and Lifestyle channel. Thank you very much for coming to watch today. Kindly subscribe if you haven't done so. This video is not to scare you, it's not to stop you from your NMC UK registration. This video is not to stop you from your UK journey. No, I am just informing you about some things that you have to know as you prepare to travel over to the UK to work in the UK health sector. The first thing is how different the hospital environment is. Yes, we expect that when traveling over, definitely the hospital environment will be different compared to the hospital environment in our home countries. But guys, the problem here is we underestimate the difference. It is totally different. The UK health system is very massive and hospitals are massive. We have 300 beds capacity, 500, 800, 1,000, 1,500 bed capacity hospitals in the UK as compared to most hospitals in developing countries which have low bed capacity. Now, if you check the whole ward environment in the UK, you will find out you can get almost everything a nurse will need to do his or her work. Unlike in most developing countries where we have to improvise, using several things to improvise in order to render nursing care to our patients. So just be prepared for how different the hospital setting is. Don't be afraid of this. Just, speak to whoever that is your supervisor. They will orientate you around the ward environment, okay? But you have to be very quick to learn because there are not much similarity if you compare the ward environment in the UK to the ward environment in your home country. So just be mindful of this. The next one is the long shift hours. I know in most developing countries, we do 6 hours shift. So you come to work 8 o'clock in the morning or 7 o'clock in the morning. By 6 hours time in the afternoon, you hand over to the afternoon nurse, then you go home. No, it's mostly, I would say 95% not like this in the UK. There are only few times that people will do morning shift and afternoon shift in the UK. The shift pattern in the UK is very long. We have 12 hours, 13 hours. I have even seen shifts that are up to 14 hours shift, okay? 14 hours straight shift. So the shift pattern is very long. You have to psych yourself. And with this, look, you are not going to escape it. For the first 1 month, okay, for the first 1 month, you may go through a lot of difficulty doing this long day shift, okay, if you are not used to it. But the thing is, after 2 or 3 months, you become used to it. And as the time goes on, you become very comfortable with the long shift hours. So just be prepared. Whilst coming to the UK, just psych yourself to do long shift hours. That is a minimum 12 hours during the day. It is just in few occasions that you'll be allowed to do a morning shift or an afternoon shift. The next factors I want to speak to you about is waking up to prepare for work and transport. Guys, this may seem funny, but it's not easy. When you have traveled from warm climates, like most climates in Africa, to cold climates in UK, please, it is difficult, sometimes difficult to wake up in the morning to prepare for work. The weather can be so cold, sometimes in the negatives, in single digit temperatures, but you still have to wake up, you still have to prepare yourself, you still have to make it to work. Okay, this is quite difficult for people who just arrived in the UK. You sometimes feel you have to pull your duvet over you and continue sleeping, but no, you can't miss work, okay? You can't call that I'm not going to work because the weather is too cold. You need to make it to work when you wake up. When you are on duty, you need to prepare for work. It is sometimes very, very difficult. Unlike the transport system in most developing countries that don't, go according to time, in the UK, if your bus will leave 7:30 in the morning, if you don't get there before 7:30 and you plan to get there exactly 7:30, by the time you get to the bus station, the bus would have left. Okay, so just know that the transport system is very time conscious. Whether it's a taxi or whether it's a bus, it's very, very time conscious. I have had stories of a lot of overseas nurses missing their transport, okay, because they thought the transport system is similar to that of their home country. No, the UK transport system is very, very time conscious, so just be mindful of this, or you're going to miss your bus every day and you're also going to miss your taxis every day. The next thing is the language. Guys, the English language here is very quick, okay? These people speak quickly and sometimes they'll speak to you in about 30 seconds and you will not hear anything that they said. You have to continuously asking them to talk to you again. You have to be continuously saying, pardon, please come again, please, I didn't hear you, please, can you tell me what you said again? Within the first 1 month, you encounter this difficulty. But again, after 3-6 months, you'll be used to how they speak and you understand them better, okay? But then, what you don't have to do is, if you don't hear the person, do not keep quiet, especially on the ward environment. So let's say a doctor wants to tell you an information about a patient. If you don't hear what the doctor said, do not speculate, do not just write anything there. Ask the doctor to repeat whatever he or she said. The next thing you have to be mindful about is the cultural difference. Guys, the cultural difference is so massive. Sometimes we underestimate it. There are so many different cultures in the UK from all over the world. Okay, and you have to be prepared to embrace all cultures, especially when you're working on the ward. So even the food, some patients eat some special food according to their culture. You need to respect that, okay? Your colleague nurse or the healthcare assistant you are working with will be from different culture. You have to respect his or her culture. If you are somebody who is not tolerant of others' culture, please, it is not advisable for you to travel over to the UK to work here. And speaking on the cultural difference, let me just say this. I know this is controversial, but the UK generally accepts the LGBT community, okay? LGBT is well accepted here in the UK. If where you come from, your home country, it is illegal for people to practice LGBT there, just know that whilst you are traveling to the UK, you'll be working with people from the LGBT community, and the person can be your colleague nurse, the person can be the doctor you're working with, the person can be the healthcare assistant you're working with. Okay, so If you think you are intolerant, if you think you can't work with those people, then I will advise you, do not travel to the UK. If you want to travel to the UK, you have to embrace others' culture. The culture difference is very massive, guys. The next thing I want to talk about is physical and emotional burnout. Guys, this is very serious. So because we are used to a certain type of rendering nursing care in our home country, when we come to the UK and we face the full cost of the UK health system, we become very tired, we become very stressed, both physically and emotionally. So just as I said, on the UK ward, you get access to every equipment. There is no room for improvisation. There is no room for cutting corners. Okay, you have to render meticulous nursing care to your patients. So for example, if you have, let's say, 12 patients, you have to assist these patients with their activities of daily living, those who are not independent, okay? All your patients who are bedridden, all your patients who need assistance with activities of daily living like washing, like eating, like dressing, okay, like mobilizing. You need to assist these patients with all this. And sometimes by the time you are done with the patient under your care, you'll be physically tired. You'll be very, very tired. Emotionally, you'll be very stressed by the time you finish your shift. So, just psych yourself that you are not coming to cut corners. You are coming to render meticulous nursing care, which will, in a way, cause this physical and emotional burnout. But this will be, I would say, within the first, few months. After some months, you become used to it and you are able to, practice your nursing. I wouldn't say the stress will stop. As for the stress, it will not stop, but you will be able to control it over time. Guys, the last and most important thing I want to talk about, and I know this can be quite, difficult, is how issues are taken very seriously in this country, okay, especially on the ward. So in most developing countries, systems are not that strict when it comes to mistakes, when it comes to some errors that we nurses make on the ward, okay? Sometimes no one questions the error that you make. Sometimes you just go free with any error that you make in most developing countries. But in the UK, on the ward, everything, even the one that that this is very small error, they can take you up. Example is drug error, okay, drug error. No matter how small the error is, they can take you up. It is not always, okay? Even if the patient doesn't take you up, your ward will do something about it. Your nurse manager will not let it just go free. And in the UK, anyone can just pick a phone and report you to the UK NMC. So you have to be very, very careful about this. You have to be very, 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 very careful, because I know in most developing countries, some things are not taken seriously. We let things go by easily. That is not the same on the UK ward. So just be very careful when you come to the UK. And also especially with the patient, okay? Just be careful how you liaise with patients, how you communicate with patients. In everything, let's try and document it. I know sometimes it's quite difficult documenting, but in everything, let's try and document whatever that happens during our shift. Just as I said, these points I have spoken about are not to scare you, are not to, stop you from doing your NMC registration. Continue with everything that you are doing. I just want you to be mindful of certain things as you plan to travel over to the UK to work in the UK health sector. Okay, there are some things that most of us didn't know that I think that you should know. It will be very helpful to you. Again, my name is Mordecai. This is the Nature and Lifestyle channel. Please kindly subscribe, kindly comment, kindly share this video for others to also know about this important point. Thank you very much for coming to watch today. See you another time.